The next speaker is Jungmin Bae. He is a Yeongnam University and director of planning committee in KSACS, and as well he is a president of Korean Emergency Surgery Society. It was invented in this year. His topic is about the practical tips in organizing ACS team experience from South Korea. Please.
Thank you. Thank you, Chairman, for introducing me. Hello, everyone. I'm Bae JM from Yeongnam University Medical Center in Korea. I'm professor and planning director of KSACS and Korean Emergency Surgery Society president. My specialty is acute care surgeon in Yeongnam University Medical Center. Thank you for giving a valuable and honorable chance to me here. I have no conflict of interest. Introducing my city, Daegu shortly. Daegu is located in southern part of Korea. The size of Daegu city is similar to Yokohama. When I was questioned in AI, there is an international airport in Daegu. Daegu airport is within a 2 hours flight from any airport in Japan. If an international academic congress will be held in the future in Daegu, I would like to invite you everyone. こんにちは。韓国を開いたベジョンミンです。招待いただきありがとうございます。日本の救急ケアする発展を願っています。The acute care system's advantage has been proven in numerous papers. Furthermore, in early 2025, Hong Seok-byung and the president of KSACS and several KSACS colleagues published a valuable paper on the ACS system through a multi-center study. This study also demonstrates numerous advantages of the ACS system. This study will be presented by Lee Hak-jae in next issue after my presentation. Practically, I established and maintained the ACS team for 2017 to 2023. Today, I briefly share my experience establishing and managing the ACS team for the past 7 years. Our team was responsible for critical care, emergency care and surgery, and ACS trauma and some elective surgeries. Our team consists of 2 staff and 3 special nurses and rotating monthly assigned resident and internship doctor. Our professors were on call almost 24 hours a day. We received external phone call through a hotline cell phone. We performed approximately 300 to 400 surgeries per year, and 90% were emergency surgeries. We had approximately 30 to 50 hospitalized patients per day. Of these, approximately 10 to 20 were critical inpatient in ICU. Our team's 24-hour schedule is structured like this slide. The morning and afternoon shifts are for 2 staff and monthly assigned residents. We manage inpatient and critical ill patients to respond to emergency room calls and perform planned surgery or emergency surgeries. At 6 p.m., we hand over care to the night duty resident. From 6 p.m., the ACS staffs are on the call at any time, either from home or the hospital. This process continued until the next early morning. This is the work schedule of weekdays. But additionally, the weekend or holiday shifts are similar to a night shift manner. This system successfully maintained the ACS team for nearly 7 years. We treated numerous patients and served as a significant ACS role in the southern region of Korea. However, this system's weak point is that it absolutely relies on 2 passionate ACS staff in my hospital, just to call hours a few men. Therefore, further efforts are needed to maintain the ACS team's stability and sustainability. Therefore, my interest naturally turned to thinking about the system for sustaining the ACS team. In Korea, while there are many hospitals within 1,000 beds similar to our hospital, and there are also many smaller hospitals within around 800, 700, 600, or around the more smaller 200 to 300 beds. And this hospital exhibit diverse characteristics such as focusing on internal medicine or surgical procedure and neurosurgical procedure and or chronic disease and so on. Therefore, I began to consider proper and tailored HS teams or HS care manner for these diverse hospitals. In 2023, our researchers conducted a body of research on the HS system. The research involved myself and KSACS President Hong Seok-kyung and several other KSACS colleague researchers. This study examined the Korean HS system based on the experience of many hospitals and the actual HS staff. This study concluded that the ideal HS system requires at least 6 passionate specialized personnel assigned to each HS department. At least the 6-member system ensures proper shift rotation and adequate rest and recharging period after work. This rest and recharging is crucial for maintaining the long-term stability of the HS system. The second proposed model is a variation of the first. It consists of 3 assigned HS specialists and plus 3 or more surgeons responsible for rotating duties. This model is similar to the model described at my hospital because it is difficult to the small number of HS specialists to handle all the work and shift. Therefore, surgeons outside of the HS department provide partial assistance. In my experience has shown that this model effectively manages the hospital's HS operations and while maintaining the HS team. But a pure gunman's dedication is essential, and this point is an important limitation of this system. Last model is that all duty of emergency surgery is performed by rotating and scheduled duty general surgeons. I believe that this model is currently being adopted by many hospitals in Korea. And next, our study revealed there are some prerequisites to operate successfully in 3 models, as I described. These prerequisites are proper reward to HS jobs, the active assistance of anesthesiologists to support emergency surgeries, and the well-equipped facility such as operating room or intensive care unit. Within 10 minutes, is all right?
Yes, please.
Take home message. In conclusion, based on my own experience, numerous studies, and the research within KSACS colleagues, actually I found that HS team system is highly effective. Several, as I mentioned, the prerequisite is important to sustaining the HS team. I believe that this HS team system should be properly applied to each hospital within diverse environment. Thank you for attention. Thank you.
Thank you very much for summarizing key components. Do you have any question, comment? Yeah, Kojima.
Thank you very much for your presentation. I'm Dr. Kojima from Science Tokyo Hospital. So I have one quick question. What is the role of assistant nurse in your ACS team? Because we do not have like assistant nurse in our team, so could you please explain?
Very good question. The more and admitted patient or more and the emergency call and more and intensive care unit and the very many job is increased. So as soon as possible, the duty of HS job is simplified by HS staffs and but other little bit slightly paperwork or very many exam schedule is operated by mechanically or regularly. So this job is dedicated to specialized nurse, and so that notified to me. So in this, according to in this system, to little doctors covered so many patients is possible.
Usually in Korea, surgeons say one good nurse assistant is better than 10 residents. Then if you have no more questions, let's move to the next speaker. Thank you very much. Next